There are millions and millions of men using anabolic androgenic steroids and other PEDs worldwide. The traditional medical community across the world has historically been ignoring this under-recognized and underserved group of men. Due to this, men on anabolic steroids and PEDs have suffered unnecessary medical complications and even death. The good news is that the medical community is becoming aware of this and is paying more attention to this underserved group of men who desperately need better medical care and attention. We are seeing more and more studies regarding how men using anabolic androgenic steroids and other PEDs, in addition to how anabolic steroids and PEDs cause medical disease. This is awesome. Additionally, I'm receiving more and more referrals and emails from traditional physicians all over the world. Times are getting much better, guys. I'm often asked, Dr. O'Connor, how do you ethically care for men on steroids? Do you support steroid use? Well, I've answered this question the same way I've answered it since I cared for my first man on steroids that night in an emergency room in Hartford, Connecticut, 2003. I do not give a blessing on steroids. I do not have to give a blessing on steroids or PEDs, not for a professional athlete who has signed a contract indicating that he will not use these agents, nor do I support the use of anabolic steroids or PEDs for men in professional bodybuilding, powerlifting, strongman, CrossFit, or for the regular man who uses steroids in search of feeling better, stronger, more confident, and sexual. These are the millions and millions of men I speak of and care for now, the regular guys. How can I care for men using steroids, you may ask? How can I not care for these men? How can any doctor ignore these men? And now, the traditional medical community agrees with me. It has to be true. It is unethical to turn away a patient that comes to you. As a healer, as a physician, a person that you know will suffer for what they are doing to themselves. The data is clear. Anabolic androgenic steroids and other PEDs have their side effects. You guys know this. Physicians have accepted that people using drugs, alcohol, and smoking, and are helping them heal and ease their suffering. And now, the millions of men that are on anabolic steroids and PEDs are being welcomed by more and more progressive healthcare providers than ever before. Yes! I have been working hard for many years to help my physician colleagues understand that men on steroids need help, and despite their strong appearance and reticent demeanor, these men are screaming for help. This is why I've dedicated my medical career to caring for men on steroids. And this is how I ethically care for men on steroids. Please, guys, let me know what you think about this, about physicians that care for you if you're on steroids or even testosterone. Have you had experiences of unethical, unprofessional care by healthcare providers? We really need to hear this. We need to discuss this. We need to educate our brothers and sisters in the healthcare facilities about this. Is there actually anyone out there that think we should not be caring for men on steroids? And if so, why? Please, guys, let's get the discussion going. I'm the leader of caring for men on steroids and expert caring for men on testosterone. It's relevant, it's a huge population, and it's about time. Thank you so much, and I really hope this video helps heal men that are on steroids and suffering. Thank you so much for your attention and your comments.